Hello everyone and welcome to the latest community conversation here at Atlantic Health System. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health, and today I am joined by two guests, actually. Our frequent viewers may know we usually have one guest here, but today, twice the information for you to consume. I'm pleased to be joined directly to my left by Dr. Faith Goldman. She's with Atlantic Breast Associates of Branchburg. And to her left, my far left, is Dr. Scott Lauter. He is the Chief Medical Officer for Atlantic Medical Group. Thank you both for joining us today.
Thank you for having us. It's a pleasure to be here, Luke.
Absolutely. Pleasure to be here.
Excellent. We have a lot of ground to cover in terms of subject matter. If the folks saw the title of this conversation, it is Take Charge of Your Health. September is National Preparedness Month, and so we're kind of taking a bit of a health spin on that concept, usually one that's about disaster planning and emergency planning. Well, this is more about avoiding those types of disasters for your health. So while we kind of give everybody an opportunity to join the room and adjust their volumes and get set up, I'll let you know that our community conversations go for about half an hour. They are usually not just the conversations between us here at the table, but there is an opportunity for you to participate as well. So in the text field, if you have a comment or a question, you want to learn a little more about something you've heard, ask it there. And our folks will try to get those questions to us so we can get to them, as many of them as we can in the time we have. This segment, in the event you're not able to stay the whole way online, is going to be posted in its entirety to the thread in our Facebook page. It'll also be on some of our other social media accounts, including LinkedIn. It will be on our YouTube channel. It will be in an audio version on our SoundCloud page for a podcast, and it will air on television on News 12 Plus, Saturdays and Sundays from 8:30 to 9. So believe it or not, doctors, I actually have that whole thing memorized in my head.
That is very impressive.
Pretty good, right? Okay.
Oh, yeah.
All right, so without any more ado, why don't we jump right into it? Take charge of your health is, we often talk about health being sort of a partnership between physicians and patients, but there are things that we need people to know, right, to make sure that they are active participants in protecting their own health. And I want to try to level set, doctors, if we can, for our audience. If you've been watching the news or even reading about it, there has been a bit of a gap in the things that people have been doing to take care of their own health lately. Some of it because of some of the way things had to be operating during the pandemic. Dr. Lauter, I'd like to start with you if you're willing. Can give us a sense of what this sort of concept of delayed care is and the way it's manifested itself over the last couple of months.
Sure, Luke, happy to do that. So, early in the COVID surge in early March, we reached out to our physicians, our patients, and we said, please delay elective, routine, and preventive care for about 60 days. We did not want to have people mingling in the community. We wanted to reduce the spread of COVID in the community. And we also wanted to be able to direct our health system resources, our physicians, our team members, to the patients that needed care during the COVID surge. So that was our message for about 60 days, and that took us to the beginning of May.
And that was about statewide, right?
That was
wasn't just
statewide,
here at Atlantic. That was
correct.
everybody.
That was across national
right.
in fact. And we had guidance from the CDC, New Jersey Department of Health, Luke. And then in mid-May, we had guidance further from Centers for Disease Control, the CDC, and New Jersey Department of Health. May 18th, NJDOH released guidance on providing safe care in the offices. And we began, opening up our offices for patients now for routine care, for preventive care. We began doing elective procedures and screening procedures and have been messaging our patients that we're here for you. It's safe to come to our offices. We're following every possible precaution and guideline to provide safe care. And we want you to resume this preventive and routine care. So it just so happens, coincidentally, that last week, the CDC published results of a survey they did. And during the COVID surge, Luke, they surveyed 10,000 adults across the country. They received 5,500 responses. And of those who responded, this was a survey about their accessing healthcare during the COVID epidemic, during the COVID pandemic. 41% of all respondents have delayed or avoided care. 32% routine and preventive care. 12% delayed or avoided emergent or urgent care. And then when they looked at people that had 2 or more chronic conditions as self-identified, 55% have avoided or delayed routine care, and 22% avoided or delayed emergent or urgent care. And that's quite concerning. Now that we can safely see patients in our offices, in the hospital, in our outpatient departments, we want to get folks back in for this type of care. What we don't want to see is a second epidemic associated with COVID. And that would be an epidemic of cancers that were not detected and not treated at an earlier curable stage, patients with chronic conditions that weren't addressed, that became out of control with the resultant effects. So we want to prevent that from occurring, and we want folks to get in now to see their physicians for these services and to have their screenings done, Luke.
Dr. Goldman, from an oncology perspective, from a cancer perspective, how concerning is this idea of delayed care folks sort of saying, you know what, maybe I'll come, I should have probably had my screening by now, but you know what, I'll come back in a couple of months. How dangerous is that as a concept?
Well, I think in general, for most cancers, we see that delays in diagnosis end up translating into patients eventually presenting with disease at a later stage. And what this normally will then mean is that we have to do more radical treatments, larger surgeries, and ultimately less curable disease. And I think in the beginning of the COVID pandemic, when we had to gear all of our resources toward accommodating these COVID patients coming through, it kind of made sense for us to delay some of these screenings, keep the patient population safe, and that over the short term, this probably wouldn't have a large impact on our cancer outcomes. But who would have thought that 6 months later, we're still seeing a trickling in of patients for their screenings for cancers of all sorts. And what we also see is that there is a decline in the numbers of newly diagnosed cancers pretty much across the board, and in particular for breast and colorectal cancers. And these are two cancers where early detection screenings are essential for lowering the stage of disease at presentation and improving long-term outcomes. We are seeing throughout this pandemic that we can safely take care of patients with the proper precautions. And I think as a medical community, we don't have those concerns with the spread of disease within our own facilities, and we want the public to come back in. But as we can see from these national polls, as well as our community polls, we have a lot of work to do in educating the public that it is safe and trying to take that other 50% of patients who are afraid to come in and changing their minds.
That's right, Faith. You know, and the surge is past us in New Jersey. Everybody did a great job. Our citizens responded to the directives about social distancing and wearing masks.
Yeah.
So we flattened the curve. In New Jersey, thankfully, we have a low transmission rate, a low prevalence of disease. So it is safe. I think one of my concerns, to echo what Dr. Goldman said, is that should we have another surge of COVID, which we hope we don't, but if we do down the road and we have to back away from doing preventive and screening and elective measures, then we've lost this window of opportunity while it's safe to have them done. So another reason to take action now and not delay, because we don't want to delay so far that we might be back in another potential surge in the future.
So let's arm our audience with some tools and some things to think about when it comes to deciding what are these screenings we need, what are these examinations I should be availing myself of. And we can run the gamut, right? From a cancer perspective, from a general health and chronic care perspective. Dr. Lauter, if you can, do you have a list of things that you think are most important? The
Sure.
ones that you really truly recommend people get in there or encourage their loved ones, right, to go in and get looked at?
Absolutely, and I'm going to defer the cancer screenings to Dr. Goldman, but certainly on the medical side, the non-cancer screenings, we have national guidance that we should be screening adults for high blood pressure, for diabetes, for high cholesterol. Everybody should be screened once for hepatitis C over the age of 18. Women should be screened for osteoporosis at age 65 or younger if they have risk factors. So that's a short list of some of the screenings that should be occurring in the non-cancer world. And certainly people that have chronic conditions, whether it's high blood pressure, diabetes, heart disease, high cholesterol, chronic lung disease, they need to come in to have those conditions assessed and treated, evaluated, and optimized so that their health is maintained to the highest level possible.
And this is with their general primary care physician? Do they need to go to specialists for that? Where would you recommend?
Well, I would say that this always starts in the primary care physician's office, and part of this is that sort of annual physical or wellness visit that we talk about, and all our physicians are following the same guidelines for these screenings. They're built into our electronic health record, into Epic, so there are prompts to remind our physicians and make it easier for them to do the right thing for the patient. And those physicals, the physical is a small part of that visit. What's important is a conversation between the physician or the nurse practitioner or the physician assistant and the patient. Talking about their their personal history, their family medical history, reviewing their medications, talking about healthy habits like diet and exercise, measuring the blood pressure and the weight, and the exam. And then that wrap-up is so important, where you have that communication with your physician. Here's where you are now. Here's what we need to have done to keep you healthy, whether it's a cancer screening or some other screening. And then here's some advice about lifestyle and healthy habits, health behaviors. That's so important. So although it's called the physical exam part of it is really a small part of it. And the important thing is that conversation in the beginning and the wrap up at the end, Luke.
We, in fact, a question we had submitted to us before the segment began was about what are the types of things that I can expect from a physical. So for the folks who are asking questions online, I hope that information was useful for you as you start to plan things out. Dr. Goldman, from a cancer perspective, we know that mammograms are a huge part of breast cancer screening and avoidance. Let's talk a little bit about the screenings that you think are really important for people to remember.
Well, absolutely. So screening mammography, without question, is the most effective single tool we have for assessing the population for breast cancer. All women have risk for breast cancer. And I think that a lot of patients come into my office and say, I really haven't had that mammography, or I haven't followed the guidelines or the recommendations from my primary care provider because I don't consider myself to be at risk. I don't have family history. I don't have one of those genetic mutations. And my answer to them is, but you have the two biggest risk factors. Unfortunately, ladies, we're women and we're aging. Can't change that. So not a modifiable risk factor, and 1 in 8 women will develop breast cancer over their lifetime. It's a very common disease, unfortunately. And screening mammography has been shown to detect malignancy at a smaller size, lower stage, and has been associated with improved survival from breast cancer, so it is an essential part of screening. All women of the age for screening should be having screening mammography. There may be patients that we can identify who have additional risk factors, and it's very important to have frank discussions with your primary care physicians, your OBGYNs, or maybe even a breast specialist about what your risk factors may be. I think we do think about things like family history, genetic mutations, but a lot of women are not aware that their breast density has a lot to do with more difficult screenings, or in fact having a higher risk for breast cancer. Other things that we might not consider is alcohol consumption, smoking, obesity, sedentary lifestyle. There's a variety of factors that we consider when we're counseling patients about how often they should be screened and with what modality. But mammography is almost always part of that. For some patients, we may add things like breast ultrasounds or breast MRIs, and we do consider that clinical breast examinations are part of screening for most women as well.
You raised a point early in your answer that I want to drill down on and really reiterate for our audience, because frankly speaking, it's something they can control and is sort of completely on the patient side of the fence in this equation. There was a survey that was recently conducted, and a lot of the material that we're talking about, by the way, the studies and some of the research, we're going to post not just on our website, but on Facebook as well. So everybody who's interested in learning a little more about what we're talking about, taking a little bit of a deeper dive, can check those things out. I think you'll find it to be very interesting. But one of the polls that we saw recently was that almost 70% of people polled said that they haven't been screened for cancer because either they're convinced that they're not high risk, or they just don't want to know the results. And that has got to be chilling for a physician to hear, because you know how valuable those screenings can be in helping a person stay healthy. I guess from a sense of we're not high risk, can a person ever truly know that? I mean, you touched on it a little bit, but if there's a myth that we can pop there, is there any way to really know for sure that you're not high risk for something?
Well, I think as we said before, with regards to mammography, we're all at risk. We all need to be doing that mammography. All of us ladies need to be thinking about that. And unless they're very savvy and have done a lot of personal research into what constitutes a comprehensive assessment of breast cancer risk, they probably should be letting their doctors help them make the decision as to whether they should be considered high risk.
And again, as we talked about, those screenings can be so effective in helping catch these things early and treatable. We hope people take this information and talk to their friends and families, let folks know. In fact, we have a campaign here at Atlantic Health that is, I mean, it could not have been labeled any clearer. It is literally called Ask Her. And that is an example of the priority we're putting on that type of work. If you want to share about how useful that is in this process, that'd be great too.
Yeah, so basically the idea behind the Ask Her campaign is that we'd really like to spread breast cancer awareness to the individual patient and also to the community. Because in addition to getting recommendations from national guidelines, our primary care physicians about the importance of screening mammography, I think a lot of women like to hear from their friends, their family, their colleague that this is an important thing to do. And we can also spread that awareness to the community.
Right.
And so the idea is that hearing it from multiple sources is going to really drive the message home that this is an important screening modality that we here at Atlantic Health feel is very safe for patients to undergo right now, not to delay, so that we can keep that preparedness for future disasters in mind and take all of these health concerns on now.
We're going to take a bit of a deeper dive into the Ask Her program a little later in the month, so you'll see some information coming out about that soon enough, and I hope everybody here will join us for that as well. We have a couple questions that have been coming through, and so I guess, Bob, forgive me, I just want to make sure I have the question correctly. Until what age should a woman have an annual mammogram? Do I have that right? Okay, so until what age should a woman have an annual mammogram?
That's a really great question. In general, we don't have a specific age that we say, okay, time's up, we don't need to do these mammographies anymore. What we normally do is assess a patient's risk, and we assess their longevity, how healthy they are. If we expect that there's a very good chance that that lady is going to be doing well, alive, healthy 10 years from now, we will generally continue to recommend that they have their screening mammography.
Got it. Bob, thank you for the question.
100%, and that reflects what we talk about shared decision making. So that's a conversation between the patient and his or her physician about their age, their longevity, their health, their risk factors, and their personal wishes and values and preferences. And you're absolutely right, it's individualized for the individual patient.
Dr. Lauter, I'm wondering, you talked about something earlier in your remarks about this concept of office safety, right? How we are keeping our practices safe places for people to be. For them, maybe that was the reason why they're still on the fence about coming in. Can you talk a little bit about what we're doing in our practices to make sure that patients are safe when they're
Absolutely, Luke. And of course, we know a lot more now than we knew early on in this. So, all of our office team members, our physicians, our NPs and PAs, they're all screened for symptoms and fever every day. So nobody's coming to work sick anymore. All of our patients are screened for symptoms and fever prior to their appointment and on arrival to their appointment. We practice social distancing, so patients are checking in online, they're waiting in their car until the exam room is ready. They go right back to the exam room, they exit back to their car, they check out electronically. There's no more sitting around crowded exam rooms, there's no more huddling around the checkout desk. It's quickly in, quickly out to minimize that physical contact. Everybody's wearing a mask, everybody in the office. All of our team members, our physicians, our patients, any companions. And of course, the constant focus on hand hygiene, cleaning the hands, cleaning surfaces and equipment constantly throughout the course of the day are all the things that we do, following all the guidelines to make sure that we can provide care safely and minimize any possible spread of disease.
Perfect, thank you. We have two questions from Kathy, and they're sort of tied to the same sort of theme here. Are there things that individuals can do to enhance their immune system, like from a nutritional standpoint? What do you recommend, at least as far as people getting answers about vitamin supplements, things like that, to increase their ability to stay healthy? Are those conversations they can have with their primary care physicians as well?
Well, absolutely, Luke, and I think it all starts with healthy habits. So we know that getting the right amount of sleep every night and not being sleep deprived, eating healthy, exercising regularly, all those are all things that help maintain your health and by extension help your immune system be as good as it can be. I don't know about supplements and those sorts of things. They generally don't harm people, so if people wish to take them, they may. You have to also be conscious of the quantities, and anything taken in excess has the potential to be harmful. But I think it boils down to the simple things of healthy habits, getting your sleep at night, exercise, eating healthy. Those are important things.
Excellent. Kathy, thank you for the question. And this also would be a good time for me to mention, if you are in need of finding a primary care physician or a specialist for any particular reason, on our website, click on Find a Doctor. It's listed right towards the top. And when you click on that, you can enter in search parameters for things, your geographic areas or specialties you're interested in finding a physician for. You can search by name if you want to as well. And it's really easy to get contact information for folks, to learn more about them. There's even videos and stuff that are on there for you to kind of hear from the physicians in their own words. So a valuable resource. Go to atlantichealth.org and look for the Find a Doctor link towards the top of the page. We touched on this very early in our comments, but we have to anticipate that audience members for this program kind of come in and out. This idea of a potential resurgence of COVID, if there is, right, and we all hope that there is not, but in the event there is, how much could that exacerbate this risk we have of folks delaying their care? There was a study in the journal JAMA, and a study by the NCI that says a decrease in cancer screenings could result in an increase of cancer-related deaths over the next decade. Could something like a resurgence in COVID-19 make that bad situation worse, do you think?
I do think that that could happen. However, we've gotten much better at delivering care safely. We've learned a lot of lessons during COVID. So how we can maximize getting information to patients and from patients without them necessarily being in the office. We've been able to really master our telehealth visits. So I think that what was previously a very steep learning curve for us is now going to be something that's much more straightforward and easy to snap back into. But that's another reason not to delay these screenings, because if we delay it now and then we need to delay it again, that's going to significantly impact the number of patients who have a delay in diagnosis. A lot of these studies have looked at the decreased incidence of newly diagnosed breast cancers, colorectal cancers, et cetera, in the early months of the COVID pandemic. And some of those studies have given us rates of a 50% decline in the number of diagnoses. The problem with that is it's not that the cancer's not growing. It's that the cancer's not being diagnosed. And eventually those cases are going to come to our attention and be more difficult to treat and potentially a lot less curable than they otherwise would be. So I think any continued delay in the diagnosis is going to have a large impact on a patient's overall prognosis in the end.
Disease does not take a vacation.
That's right.
Mm-hmm. Dr. Lauter, what about flu season? You know, we talk about some of the things that we need to be preventing for in a normal year, let alone one where there's not a pandemic underway.
So we absolutely want everybody to get their flu shot this year. We know the flu vaccine, it's not perfect, but it's good, and sometimes perfect is the enemy of good. It's good. It does reduce the severity of influenza illness. It reduces the duration. It makes it less likely that you'll have a complication or have to go to the ER, get admitted to the hospital. So the flu vaccine is important. And we would normally have recommended people get vaccinated in October, November. We're pushing it up this year to make sure that people get in and get it done. So really, now's a good time to get started with flu vaccination in September and going forward. It takes about 2 weeks for the protection to be effective, Luke. There's been a lot of discussion about, well, does a flu vaccine protect against COVID? Not directly, but we know when people are vaccinated, it does stimulate the immune system, so there may be some potential spillover effect from having your flu vaccination. But we sure don't want to have people get COVID and flu at the same time. And so very important to get your flu vaccine. And that really applies to everybody over the age of 6 months. Certainly high-risk individuals, should be concerned and make sure they do get in to get the flu vaccine, but it really applies to everybody. Everybody's at risk for the flu. It doesn't discriminate.
And complications can be pretty severe for some patients, right?
Correct. Being hospitalized, being in the ICU, having extensive pneumonia, these are things we want to prevent and avoid. And those things happen to younger people as well as older people, Luke. So this applies to everybody. And there's other vaccinations that you don't want to forget about. So if you're 65 or older, you should get your pneumonia vaccine. If you're younger and have certain other conditions, you would qualify for that vaccine as well. Older adults shouldn't forget about the tetanus vaccine that's due every 10 years. Shingles vaccine is now available for folks over the age of 50. So there's some other things to remember. And don't forget the childhood vaccines for our younger children and young adults. But the flu vaccine has got to happen this year. It's so important.
Excellent. We have just a few moments left. Actually, we have another question here. In fact, Dr. Lauter literally read your mind, Kathy. The question was, should you get a pneumonia shot? And so to answer your question, I'm assuming that is the
Right,
pneumonia
so age
vaccine
65 and older, yes. Younger if certain conditions. It's a lot easier now because there was the original flu vaccine that covered 23 strains, then along came the 13 strain, and for a while we were recommending both to adults. Get one, wait a year, get the other. It made it kind of complicated, but more recently the evidence has been clear that the 23 strain vaccine is the one to go with. So it's easier. Everybody should get that at age 65 or younger if you have chronic conditions. And then the other pneumonia vaccine, the 13 strain vaccine, is for people that have certain unique conditions or chronic conditions. So it's easier for your primary care physician now to choose and administer the pneumonia vaccine. Again, like the flu vaccine, it's not perfect, but it's good. It does reduce the incidence of pneumonia, but more importantly, reduces the complications and reduces the risk of lung failure, of other complications associated with having pneumonia. This is from the pneumococcal bacteria, the commonest cause of community-acquired pneumonia in our communities.
Excellent. Go ahead, Dr. Goldman, did you want to?
I was just going to say, I'm convinced. I'm calling my mom today.
See, there you go. And I hope everybody is listening. We have literally, we're down to our last few minutes here, so I tried to end these if I can where we start, because I think it's important to reinforce the reason why we're having this conversation to begin with, and that is that for throughout this pandemic, really, especially in the early going, there was quite a bit of care that was urgently needed by a lot of folks, or wasn't important, I shouldn't want to say urgent, but it was important for their well-being that was delayed or deferred. And that we are now in a time where it is time for people to stop that level of delay and to return to care. So if we can, if I could ask you one last time, we'll just sort of summarize it in the last minute we have here. What would be your most important takeaway for folks as it relates to getting back to care, getting those screenings they need, protecting their wellness? I guess the Reader's Digest version, if you will. Dr. Goldman, we can start with you if you want to touch on that before we go.
So my take-home message would be screening mammography, essential. It's a good time to do it now. We don't want to wait and see if something else comes up with COVID later. We're a safe environment to have your screening mammography performed, and we're ready for you. Please make an appointment and tell your friends.
Excellent. Dr. Lauter?
I could have said it better. It's safe to see your physician. Let the physician be your trusted guide. See your physician, have your physical, have your wellness visit, have them identify what needs to be done to close your gaps in preventive care, to address your chronic conditions, and make sure all those health needs are met, that we can keep you as healthy as possible.
Excellent. Dr. Lauter, Dr. Goldman, thank you so much for joining us today.
My pleasure.
You're welcome.
Thank
Our
you.
pleasure as well. Thank you very much, Luke.
All right, folks, we covered a lot of ground today, but as we mentioned, a lot of the material that we talked about today will be available on our Facebook thread and on our website. If you missed any part of this, please be sure to catch the entire thing on the thread there, or on some of our social media channels, or on our website, atlantichealth.org, where you can also, by the way, not that this isn't the best one we've done, because it is, but all the other ones are there too. So if you want to see some other ones that you might find interesting as well, all of our community conversations live there, so be sure to check them out. Again, thank you so much for joining us. Do not delay care. Check in with Find a Doctor on our website if you need to find a physician for yourself. And thank you so much for tuning in. I'm Luke Margolis, Corporate Communications Director for Atlantic Health System, and we will see you next time.